Hey everybody, today we are in a Zoom call, and that ain't that bad if you think about it, because that means I don't have to be around anybody. So, I am doing a video with all of these people, and we made a video about COVID-19 and how different groups are affected by COVID-19.
Our group chose this topic because it is something that we are all going through today. Despite your race, income, location, age, we are all impacted, but we wanted to express that we are impacted by it in different ways.
How our group is going to spread awareness about this issue is by posting and advertising our video that we created about how different groups of people have been severely affected by coronavirus and what we can do to help them. Our video is going to be posted on YouTube as well as a way of advertising and broadcasting it in order to spread awareness. Additionally, it has important information which can help guide people in many ways they can help.
What we hope to accomplish with this video is to spread awareness about how COVID-19 is affecting everyone differently and how it's affecting different communities more severely.
And here is the video. Well, here we go. COVID-19, a disease spread like wildfire, is affecting many people around the world, and in theory, affecting many people. People are dying and spreading this horrible virus. This is some of the few that are affected.
Studies show that COVID-19 may also have more severe effects on different ethnic groups. It was proven that the mortality rate for Black, Indigenous, Pacific Islanders, and Latino Americans from COVID is around 3 times as high as white Americans, who have the lowest mortality rate in the country. Every race has an equal chance of getting this virus if you were just discussing genetics. But what separates the different ethnic groups is where certain groups are more likely to reside and work and how likely they are to have access to things like medical care and protective gear. A specific minority group that has the highest mortality rate in the US from COVID is Black Americans. The reason for this is because they are more likely to be exposed to the virus. For instance, 30% of employed Black Americans work in education and health services, and 10% work in retail, which are jobs that are not very likely to allow workers to telecommute. How different ethnic groups travel to work also plays a part in why minorities have a higher mortality rate from COVID. Around 34% of Black people use public transportation on a daily basis, which is more than the 14% of white people that use public transportation. Furthermore, minorities in this country have less access to medical care. Inadequate health insurance, discrimination fears, and location make it hard for certain groups to get tested and get the care that they need if they were to exhibit symptoms of the virus. Also, minority groups are more likely to face hidden bias to medical care. According to Science News, an algorithm used to determine which patients should receive access to certain healthcare programs inadvertently prioritized white patients over African American patients. With this being said, it is important that we spread awareness to people of different ethnic groups and emphasize how their lifestyle heavily impacts the risk of getting coronavirus.
Throughout this video, we have been talking about different groups of people who have been severely affected with coronavirus and how we can help them. The next group that has been the most severely affected is age, as in the elderly ranging from 60 to 80 years of age. This is due in no small part of the number of underlying health conditions present in older populations. Conditions like diabetes, heart disease, and other chronic illnesses can lead to more intense symptoms and complications in the disease. Additionally, as people age, their immune system gradually loses its resiliency, meaning that they are more susceptible to infection of any kind, especially a new one like COVID-19. Although children, especially those without underlying conditions, seem to be less affected by COVID-19 than other groups, they are still likely to be carriers of the disease. The most effective way to help elders in the first place is to limit in-person visits so they don't end up being infected in the first place. Although some elders are, it may be difficult for older adults who cherish time spent with their loved ones. The second way we can help them is to introduce them to technology such as apps on devices to provide hearing or text messages or even FaceTiming when feeling alone. The third way we can help them is by keeping them involved and giving homebound older adults a project they can work on. Older adults should put off non-essential travel, particularly cruises or trips with itineraries that would expose them to crowds. Going for the fourth way we can help them is to decide on a plan on how you'll manage routines and interruptions if someone does become sick. Talking things through ahead of time as a family can reduce stress and help everyone feel more involved and prepared. The fifth way is to make seniors informed and up to date about COVID-19. The sixth way is to be the person they can vent to in a hard time like this. Blood supplies in hospitals are low, and by donating, you can help seniors who are not only at risk for COVID-19, but other conditions. Having a stocked blood supply will be beneficial to all.
Well, there we have it. This is how we, as a community, can help people in this COVID-19 crisis. Thank you all, and have a great day.